So there are a lot of infectious illnesses that are actually more prevalent in children and pediatric populations, but it is important to note that with these, older children and adults can occasionally contract them as well. So don't rule somebody out just because you say, oh, well, it's a childhood illness. It can happen with older people as well. So croup is a viral illness that causes inflammation of the airways, including the vocal cords and the subglottic area. This is also called laryngeotracheobronchitis, which is a whole lot. Croup usually is a little easier to say. So this illness starts with your upper respiratory symptoms like a sore throat, runny nose, low-grade fever. And then after a day or two, they develop this kind of inspiratory stridor, this hoarseness, and then a seal bark cough. Generally, the symptoms are going to be worse at nighttime. In most cases, it's fairly mild, but it can lead to respiratory distress and even airway obstruction in severe cases. So like in milder cases, your inspiratory stridor usually is only during activity. In your more severe cases, it can occur even at rest. You want to look for signs of airway obstruction, increased respiratory effort, suprasternal retraction, tripoding, accessory muscle use, fatigue, altered mental status, cyanosis, things like that. For your mild to moderate cases, don't agitate them. Leave them alone. No unnecessary procedures because crying is going to make it worse. It can worsen the edema and it increases oxygen demand. For patients with severe hypoxia, or with severe cases, treat your hypoxia and your hypoventilation. Humidified oxygen is preferred to prevent your drying and further swelling and irritation of that airway. Occasionally, in the pre-hospital setting, you may be able to give nebulized racemic epinephrine, but usually this is at the paramedic level and only in the most severe cases. Now, if it gets to the point where intubation is required in the severe cases, only if it's in your scope of practice and indicated, then whoever has the best intubation skills should perform it because we don't want to worsen any edema or airway obstructions. And you want to use an ET tube about 0.5 millimeter to 1 millimeter smaller than you would normally use for that patient because of that potential edema in there. Now, historically, they've advised for cool mist or steam as some treatments for croup, but there's no real new evidence that shows that this is effective, but nor is there anything that shows that it is detrimental either. Now, epiglottitis is a bacterial infection that causes swelling of the epiglottis. This is important because the epiglottis is kind of the entry point into our airway, so if it gets irritated and clamps down, we're not breathing. Okay, it's rare. Fortunately, it does not occur super often, but when it does, that patient looks really sick. They're going to have a fever. They're going to have difficulty swallowing and breathing. They're going to drool. The reason they're drooling is because they can't swallow the excess saliva that they are producing. Usually they're going to be in tripod position because of the airway, and they may or may not have stridor. But as that airway obstruction increases, the stridor is going to start to subside a little bit. As with croup, keep the patient calm. If there are signs of hypoxia, you may want to consider some humidified oxygen by blow-by. You don't want to put anything on their mask or on their face like a mask or do anything that might cause them to get upset and cry or have a problem there. If they are in respiratory failure or arrest, then you need to ventilate the patients. Okay? Do not put anything in their mouth. Do not visualize the airway. Keep them calm. And if you suspect there might be a need for a surgical airway or something like that, then you would want to consider contacting your paramedic response and transport without delay to the nearest appropriate emergency department. Now, your measles and rubella are viral illnesses that cause fever and rash. And measles is kind of at the forefront right now of some of the vaccine wars, if you will. People who don't want to vaccinate, people who do vaccinate. Science is firmly on the side of vaccination. Vaccines don't cause autism, but they do have some potential side effects. But what we're going for is herd immunity. If we have the majority of the people immunized, then the people that can't get their immunizations have a better chance of being protected against these diseases. Now, to be fair, they're usually more mild in nature, but they can have really serious complications like pneumonia and encephalitis that can lead to death. Your mumps are going to be a viral infection that's going to affect your glandular tissue, and it especially the parotid salivary glands. And this causes a really painful swelling there. All right, usually will resolve on its own in due time. Now, for your varicella, or more commonly called chickenpox, this is a virus in the herpes family. Not like herpes like we typically associate it with, but it is in the herpes simplex virus. It causes malaise. It causes itchy, fluid-filled blisters on the skin that will eventually crust and scab over. It's very, very, very contagious, and it's easily spread between people who are not immune to it. Now, after recovery, the virus can go dormant in the body, and it usually is going to reside in a dorsal spinal nerve. And what happens is it can later on in life be reactivated. And this causes a painful unilateral rash, and this is called shingles. If a patient has shingles, they can transmit the virus to somebody who's never had chickenpox or been immunized against the varicella. Shingles can happen at any age, but usually it's going to be in your older populations. It's not super common in your younger people. Right? And they actually have a vaccine for the shingles for those who are 50 years old or older. All of your healthcare providers should be vaccinated against these diseases. The illnesses themselves, there's no specific pre-hospital treatment. We're going to provide supportive care. We're going to manage the ABCs, and then we're going to notify the receiving facility that we're transporting the patient suspected of having one of these illnesses.